Hi, Dr. Mom. Now, what if I told you there's a home remedy that costs about $3, can help with fevers, congestion, headaches, sore throats, and more, and it's so effective that my 4 kids actually ask for it in the moment they feel sick. All right, mamas, it's called cold, wet sock therapy, and in the next few minutes, I'm going to show you why it works, when to use it beyond fever, and exactly how to do it step by step without the stress. All right, I'm Dr. Elana Rommel, pediatric naturopathic doctor, mama of 4, and the founder of Med School for Moms. I'm here to help you become a doctor mom, calm when illness hits, confident in your tools, and clear on what to do next. Okay, quick story before we get into the how. I have 4 kids, and what makes me smile is that they actually ask for cold wet socks at the very beginning of basically any ailment. Okay, they're like, can I do cold wet socks? And I'm like, yes, let's do it. They already grab it. They know what to do. Now, they know what to grab. So they grab the wool socks, they grab the cotton socks, and they've seen this over and over, and they just know how it helps support the healing process, okay? It's honestly become part of our medicine cabinet, not because it's fancy, but because it's reliable and simple. And I love that it gives kids a sense of confidence. They know what to do when they don't feel good, right? They can be proactive. So that's what I want for you too. And I want that your home feels prepared and not panicked. All right, let's jump into takeaway 1. So let's start with the why, because once you understand what's happening, this stops feeling like a random home remedy and it starts feeling like a tool you can use on purpose. Okay, so cold wet socks are an easy, inexpensive therapy that helps stimulate, the immune system by increasing circulation in the body. Now, when cold, wet socks are placed on the feet, the brain sends signals to the body to start pumping blood, moving blood flow so that we can warm up those cold socks. Now, that shift helps increase circulation, and that circulation supports the immune system. Now, immune cells that act as that first responders tend to show up faster. They tend to do their job more effectively when that body heats up. So this therapy supports the body's own healing process in just a simple, physical way. And I love this because it's one of those tools that feels empowering. You're not trying to control everything. You're just supporting the body while it does what it already knows how to do. All right, now takeaway 2. This can be used for more than just fevers, okay? Most moms hear about cold wet socks and they think, oh, fevers, but yes, it can help. Absolutely. It can help so many more things. So I just want you to know that this is not a fever-only tool. Now, cold wet socks can be used for things like nasal congestion, coughs, sinus infection, sinus congestion, upper respiratory infection, sore throats, headaches, migraines, and just general discomfort. Okay, this is also why they're called magic socks. Okay, and how do they work so well for all ailments? It's simply because it's working with the body and it's working as a general immune stimulant. So it's really not magic, but your kids can think they are. And it makes it more fun. So here's to that. Now, if your child is in that fuzzy zone where something's coming on, they're just not feeling like themselves, this can be a supportive option for you. All right, let's get into takeaway 3 because I want you to understand the super practical step-by-step exactly how to do the cold wet sock therapy. So here's what you're gonna need. You're gonna need 1 pair of just thin cotton socks. I should have probably washed these before, but they're here. Okay, 1 pair of wool socks. Okay, these are just socks that I took out of my kids' bin, and really in our medicine cabinet, so let's work with what we have. And then a bowl that you're gonna fill with ice cold water or just cold water, okay? Some people use vinegar and they add it. You can or you can't, it works great. Okay, so here's the protocol. Step 1. You start with warm feet. This is key. This matters, okay? The treatment won't work unless the feet start warm. And the easiest way to warm up the feet is maybe place them in a little warm bath or a shower, okay? Now, step 2, dry your child off completely. So dry them off fully while their feet are still warm and ready. We can move on to step 3. All right, step 3 is get your cotton socks wet. So you're gonna dip them in a bowl of cold water, ice water, or again, a little bit of vinegar. And the key is that they're really cold. And now the quick tip is you don't need to use ice cold water for your child, especially if they get aggravated. So cold water works just fine. Okay. Step 4, you're gonna take them out of the water and you're gonna wring them out, okay? Wring it out so all that excess liquid so they're not just dripping everywhere. All right, step 5, put the wet cotton socks on your kiddo. All right, so go ahead on those warm feet, just put them right on, okay? All right, step 6, now we've got this out of there. You're gonna now take your wool socks and you're gonna put those wool socks over the wet socks. So dry wool socks over those cotton wet socks. All right, now you put them to bed. Tuck your child into bed. In the morning, you should find those socks dry, those feet warm, and that's where all the healing happens because all that circulation is just continuously all night pumping throughout the body to dry those cold wet socks and those cold wet feet, okay? All right, now frequently asked questions because I love these. How long do you leave them on for? Now, the answer is you leave them on until the cotton socks are completely dry. That's your sign the body warmed them up and the therapy has ended. Then you can take them off. Okay, how often to use them? Now, cold wet socks can be used as many times as your child will let you, but a simple goal is at least 1 per day, at night, but during illness until symptoms have completely cleared. Okay, when to start cold wet socks? It's the best to start at the immediate onset of symptoms. And yes, adults can use them too. Another great question is, does it have to be at night? No. It's just the best because if you put them to bed, they're not touching it. They have them on for a certain number of hours. You know they're going to be dry by the time they wake up. Can you do it during the day? Of course, go for it. But the goal is to keep them on long enough where the body warms them up and they don't take them off. Okay. Now, a couple safety notes. This podcast is for educational and not medical advice, okay? So please always talk to your doctor about what is right for your child, especially if you're unsure. Now, cold wet sock therapy is a very safe option, and I recommend starting it when your child's at least 6 months old. I wouldn't do it earlier than 6 months, okay? And for young kids, I also don't recommend using the ice cold water. Just use regular cold water, okay? And it's still gonna work well. Now, Mom, if you're sitting there thinking, I'm not sure, I don't know what to do, is this safe, it's not, it's always okay to call your doctor. You're not bothering anybody, you're being a good mom. Okay, let's recap the 3 takeaways. So why it works, it helps stimulate the immune system by increasing circulation. Okay, when to use it, it's not just for fevers, okay? It can be used for congestion, headaches, sore throat, plus just those general sick days where there's discomfort. Okay, number 3, how to do it, right? You warm the feet up first. You take the wet cotton socks, put on the dry wool socks, and then leave them on until the cotton socks are dry. Okay, and now if you're thinking, I love having tools like this, that's exactly what we do inside the membership, okay? In Med School for Moms, we talk about cold wet socks and so many other different therapies that you could do at home. Now, I love teaching not only home remedies, but also health food supplements, herbal medicines, homeopathy, and even conventional medicines when they're warranted. There are many tools we can use as a doctor mom. Now, my goal is to help you feel calm, confident, and clear on what to do next. And because you're here listening, I'd love to give you a special offer for 50% off your first month. Use code podcast50 at checkout. Now, if you want to support building that toolkit, come join us at the drmommembership.com or click the link in the description. If this episode helped you, share with a mom friend who would love a simple sick day tool. And the next time your house feels like it's heading into that illness week, remember, you don't need to do everything. You just need a few options that you trust. You got this, mama.